Discussing additional valvular disease questions is Heart Center cardiologist Dr. Lawrence Solomon. How is valvular disease treated?
Well, this is the real art of medicine because, as I mentioned before, most patients with valvular disease do not require treatment. Valvular disease in most patients is something that gradually progresses over time, and it's not until the valve disease becomes a more severe problem, potentially causing symptoms or potentially affecting the function of the heart or causing congestion in the lungs. It's not until that point, in most cases, that treatment is actually needed. When treatment is necessary, it generally involves surgery. We're dealing with a mechanical problem with the valve, and unfortunately, medications cannot cure that type of problem. Although the medications may be helpful at controlling symptoms or delaying the progression of the disease, they generally are not useful in terms of curing the disease. So this is where the real art of medicine comes into play, and much of my time at the Heart Center is spent addressing just this type of question with patients. When is treatment necessary? And it's not always an easy question to answer. When it is clear that treatment is necessary, surgery, as I mentioned, is really the primary mode of treatment. Traditionally, this involved open heart surgery to either repair a heart valve or to replace a valve in some instances. More recently, there have been some newer techniques that have been developed and are now becoming more widely available, in which treatment can be accomplished via a catheter-based approach, where a catheter or a small tube is inserted in one of the arteries in the groin, passed up to the heart, and this can enable us in some instances to repair a valve or even to replace a valve. This is one of the newer techniques now becoming more available, and potentially enabling patients a cure without the need for a major open heart surgery.
What should a patient with valvular disease be particularly aware of?
It's very important for patients with valvular disease to understand the importance of close monitoring by a cardiologist. The dreaded outcome with valvular disease is someone that has valve disease that goes untreated, becomes severe, and affects the heart function. This can lead to permanent dysfunction and damage to the heart. So it's always important to have close monitoring by a cardiologist to ensure that the valve disease is not causing heart damage.